Dr. Hassan, and I heard you were having some memory loss symptoms. Can you tell me a little more about that?
Yes, so I had an appointment for last week, but it just totally slipped my mind, and but it hasn't just been like with that like one occurrence. So like I was cooking the other day, and my husband came home to smoke just filling like our kitchen, and I was upstairs showering. So now like he leaves like sticky notes everywhere, telling me to like call him, and then he reminds me to like eat breakfast, to feed like our cat. But like I'm also forgetting little things such as like birthdays and like what time it is, the date, meetings, just like every like day things that like I shouldn't be forgetting at my age. And like what I'm worried about is like that psychological disorders are like have been like in my family like past generations and everything. And so I was just wondering if I could like get a brain scan today.
Sure, absolutely. So I will definitely call the nurse in and our resident, and we will get that for you right away, and we'll see what your brain scan says.
Okay, thank you.
Hi, ladies.
Hi.
Did the brain scans turn out okay?
Yeah, everything's right here. You can unfortunately see Alzheimer's is starting to develop.
Yeah.
So is there some sort of basis for this disease?
Yes, actually. So as you can see here in the microscopic image of her neurons, there's a buildup or some sort of accumulation of the amyloid plaques right around the neurons.
So these protein fragments usually break down in healthy cells. As you can see right here, there are just cells. But in the Alzheimer's cells, the fragments form hard insoluble plaques, and you can see kind of these gray areas right here where they attach to the neurons.
Okay, so why does that happen? I'm a little confused by that.
Well, this is mostly due to also the buildup of the plaques, but it's mostly in insoluble twisted fibers that are also located in and around the neurons that make this kind of problem occur in the nerve cells.
And these are mainly made of proteins, and these proteins are called tau, which forms in microtubules. And you know that the microtubules are what helps transport substances and nutrients from cell to cell, but in Alzheimer's the protein's abnormal and the microtubule collapses, causing the nerve to be damaged.
So just to recap, this is due to the neurofibrillary tangles occurring by the neurons that therefore just block the communication, therefore they end up building up and dying. Does that make sense?
Yeah.
Okay, are you ready to explain this to our patient?
I think so.
So Nurse and our resident here, Miss Rock, had the chance to look over your scans, and we believe that you're showing the symptoms of Alzheimer's, which is a chronic neurodegenerative disease that affects most parts of your memory. Resident Rock here is going to explain to you what's going on. Emily?
Okay, so basically to put things into perspective for you and give you a better understanding of what's going on, basically in a healthy brain or a normal brain, there are nerve cells, also called neurons, which have microtubules which send nutrients and other substances down axons, which are these long thread-like extensions that conduct nerve impulses away from the nerve cell. Unfortunately, in your case, there are neurofibrillary tangles, which are insoluble twisted fibers consisting of an abnormal version of tau, which is a protein that causes the microtubules to collapse. These tangles essentially destroy the vital cell transport system that is necessary for your brain to keep functioning properly.
So in simpler terms, the parts of your brain that are in charge of memory, learning, thinking, planning, anything like that, those are degenerating very quickly because the cells within them are dying. So the cerebral spinal fluid holding vesicles inside your brain are going to enlarge due to the surrounding areas shriveling up.
So usually in a healthy brain, going back to the plaques we were referring to earlier, the protein fragments we were talking about would usually break down and help the flow just speed. But unfortunately, in the case of Alzheimer's disease, the fragments accumulate and then form hard insoluble plaques, such as you see here with the amyloid plaque. And then that blocks the communication in between neurons. So when the neurons can't talk to each other anymore, they sort of just shrivel up and die. And then the progression of that throughout your brain is the big cause of the Alzheimer's. In Alzheimer's disease, typically progression is slowly in 3 general stages, which is mild, moderate, and then severe. So you're currently showing the early stages, which the symptoms of the early stages are memory loss, such as what you are experiencing now, and then once the stages progress, you start losing your speech patterns, some learning, things like that as it gets more severe and it progresses down the road.
So basically what you're saying is like the cells in my brain are dying, which is why I can't remember anymore?
Yes. So basically, if you look at this image, there's a healthy brain and an Alzheimer's brain, and on this side where it's healthy, you can tell that the cortex is intact and it is not yet shriveled up, whereas in the advanced stages right here, you can tell that there is very little remaining, and that is due to the degenerating cells. And that is going to be worse in the hippocampus, where your memory center lies. So those cells are going to die the quickest and the most rapidly at the beginning, which is why it's so fast onset.
Looking at it on a more microscopic scale, within a healthy cell, the areas where the tangles are forming are usually straight lines. They're organized in ordered parallel strands, kind of like railroad tracks as you can see here, and everything just flows through kind of nicely on these tracks. There is no blockage, and a protein that's called tau helps the tracks stay straight and stay in formation. And it's also up right here where you can see the microtubules, and tau is just helping the axon stay straight. Communication is very clear. But then, unfortunately, in the case of Alzheimer's disease, the tau proteins collapse into twisted strands and it tangles up, as you can see here, and also on the other image on the right. And it just causes, once it tangles up, that everything starts to fall apart and degenerate because the tracks are no longer straight. Nothing is still flowing as continuously as we'd like to see. And the nutrients and other supplemental supplies for your body and for your brain cells can no longer travel through those straight lines anymore. So they eventually, the neurons stop getting the nutrients that they need, so the neuron starts shriveling up and dying.
So is there a cure, or am I just, like, how many years do I have to live, or am I just, like, gonna die tomorrow?
Resident Rock.
Well, we don't actually know for sure. Unfortunately, right now there is no known cure for Alzheimer's. I can tell you that you have about 4 to 8 years until the final stages. But moderate Alzheimer's is the next stage, and that is typically the longest stage. You will be experiencing, or you could experience, I should say, confusion and personality and behavioral changes, and this can also last for many years.
After you complete that stage, there's another stage. The final stage, you could lose the ability to respond to your environment. You could lose the ability to carry conversations, even to eventually control movement. As she mentioned, there's currently no cure. There are some medications that can help you with your symptoms. There are some medications that can help alleviate the memory loss. There are many clinical trials you can participate in to help find a treatment, find a cure for this. You may progress through this differently than other patients we have. Typically, the longest is 20 years. There are many other factors that contribute. So there are many different ways this could go. Everyone responds to this a lot differently.
So to summarize and just to recap, the breakdown of it is that over the course of the next year or so, healthy brain cells on the part of your brain that makes you function well enough and that makes you remember will start to shrink, and those parts of the brain, as we explained with the neurons and just the brain sections in general, will start to slowly die off and shut down piece by piece as more parts of the brain start to shut down, and you'll begin to slowly down and stop working like the brain function. And then we'll prescribe medication, of course, to help you, but you will most likely need around the day care at this point in time and also throughout the future. Currently, you're experiencing the normal slow symptoms as if more normal memory loss. You're forgetting where things were put, what happened on a day-to-day basis. As it progresses, you will need more care.
Keep in mind that memory will also become almost non-existent. You may, in the final stages, also lose the ability to feed yourself, speak, recognize people, places, lose control over bodily functions. This terminal disease can last as long as 20 years, as we mentioned before. But if there is anything else you would like to know, now's the time to ask.